And Representative Whalen, if you would like to go ahead and talk about House File 2573.
Yep. Thank you, Madam Chair and members. Thank you so much for the opportunity to present this bill. I'd like to begin by providing just some brief background. In 1998, Minnesota passed a law requiring data related to abortion to be collected and maintained by the Department of Health. Since that time, we've seen a lot of changes, and currently there's a gap in the reporting requirements on abortion, which leads to an incomplete picture of abortion in the state of Minnesota. Specifically, the gap concerns telemedicine abortions, which involves a physician in one clinic and the patient in another clinic. The bill before you seeks to address this gap in information in order to provide a more complete picture of abortion in the state of Minnesota. Notably, I think we all agree information is valuable in helping lawmakers make policy decisions, and as MDH states on their report, the data they provide are important both from a demographic and public health viewpoint. Data from reports of induced abortion provide unique information on the characteristics of women having induced abortions. Uniform annual data of such quality are nowhere else available. Medical and health information is provided to evaluate risks associated with induced abortion at various lengths of gestation and by the type of abortion procedure used. The bill simply adds a requirement to the current report on induced abortion, which you should all have a copy of. If you look to the form, it requires the facility code be reported, and this bill simply requires, and I will refer you to line 3.1 to 3.2, that if the abortion was performed via telemedicine, the facility code for the patient and the facility code for the physician are both reported. This language was discussed with the department last year, and I reached out to them again this year before the hearing. I believe they're here to answer questions. And members, before the hearing today, I also reviewed the audio from last year's hearing, and I just want to be very, very clear. According to current requirements in law, the commissioner must ensure that none of the information included in public reports can reasonably lead to the identification of an individual performing or receiving an abortion. I can repeat that. Privacy is protected, and to my knowledge, there has never been a case of a woman or a doctor being identified from this public data. So to that end, I would say the department has done a great job on this and we should have no concerns. So I refer you to your packet, which also includes a copy of the statute 145.4134. In closing, and again to be clear, this is just updating the current reporting form to provide a more complete picture of abortion in the state. This is an update to current reporting requirements. And Madam Chair, I'll stand for any questions.
Thank you, Representative Whalen. Member questions?
Oh, could we do, I'd like to hear some of the testimony, Madam Chair.
Okay.
And,
All right.
and maybe ask questions after that.
Okay. Is there anyone in the audience wishing to testify for or against this bill? I believe I have Andrea Ledger is in the audience. Good morning. Welcome to the committee. Please state your name for the record and proceed with your testimony.
Good morning, Madam Chair, members of the committee. My name is Andrea Ledger. I'm the Executive Director of NABRAL Pro-Choice Minnesota, and I'm here to testify in opposition to this bill. This legislation is unnecessary, and it discriminates against a particular type of medical procedure. The facts are that medication abortion is extremely safe, that providers are already subject to numerous reporting requirements, and that this bill would single out abortion for a granularity of reporting not required of any other telemedicine procedure. Medication abortion, which can be provided via telemedicine, has an over 99% safety record. The number of adverse events associated with the medication used for medical abortion is less, for example, than for such medications as Tylenol and Viagra. The Minnesota Department of Health 2016 report on induced abortions disclosed that 1/3 of women in Minnesota choose medication abortion. Telemedicine is a method by which physicians provide medication abortion and is just as safe as medication abortion accessed in the same location as the physician. A study of Iowa patients found that 600 women utilizing abortion via telemedicine had comparable clinical outcomes to those who saw a doctor in person. The American Congress of Obstetricians and Gynecologists opposes legislation that creates barriers between patients and physicians, including attempts to restrict medication abortion via telemedicine. Telemedicine is becoming more common practice in all of medicine. In fact, in just 2015, the Minnesota legislature, led by a bipartisan coalition, voted to expand telemedicine by requiring insurers to provide reimbursement parity for telemedicine consultations. The system of telemedicine is especially important for Americans who live in remote or rural areas and do not have access to a nearby doctor, or who need a specialist located across the country. Approximately 1/4 of Americans live in rural areas, while only 10% of physicians practice in these areas. 95% of Minnesota counties have no abortion provider. It's extremely difficult for some women to travel to a reproductive health clinic where they can access abortion services directly from a provider. No other telemedicine procedure has been singled out for this kind of additional reporting. The report on induced abortions in Minnesota is already a lengthy and comprehensive document, with the 2016 report of 2015 data coming in at 32 pages, and it includes demographic data of women seeking abortions, numbers by count of women seeking abortion, county of women seeking abortion, the type of procedure performed, the reason for abortion, and complication rates. In an atmosphere of heightened rhetoric against abortion providers, we should be hesitant to create additional reporting requirements that could lead to identification of both patients and their doctors. A 2015 ProPublica investigation determined that anti-abortion extremists see state-collected abortion data as a resource for targeting and harassing patients and providers. According to the investigation, quote, abortion opponents have become experts at accessing public records, such as recordings of 911 calls, autopsy reports, and documents from state health departments and medical boards, then publishing the information on their websites. The bill before you today does nothing to protect women's health. Instead, it lays the groundwork to create additional barriers for women. Thank you for your time today.
Thank you. Is there anyone else in the audience wishing to testify for or against this bill? Seeing no one, we will open it up for member questions. Well, first of all, I'll give Representative Whalen a chance to weigh in on any of those statements. Or if you don't want to, that's fine too. We could just go to member questions.
Well, one point I'll just make, thank you, Madam Chair, and thank you to the testifier for their engagement on the issue. To the point that it is unnecessary or discriminates, and there are already many reporting requirements, this issue of telemedicine abortions in particular is clearly something that across the country has caused concern among other states, because several states have actually banned it.
Thank you. Representative Howe, you are first on the list.
Well, thank you, Madam Chair, and I was going to ask the testifier, but I guess I'll ask Representative Whalen, is there anything in this change in reporting requirement that bans, from the testifier's comments, I would think that this is going to restrict those in rural areas that look for this procedure, that would restrict them in any way. Is there anything in here that restricts their access to this procedure?
Representative Whalen.
Thank you, Madam Chair, and Representative Howe, no.
Representative Hillstrom.
Thank you, Madam Chair. Representative Whalen, is there any other procedure performed via telemedicine that you collect any of this data on? Any other?
Representative Whalen.
Thank you, Madam Chair, and Representative Hillstrom. Other telemedicine procedures are subject to certain reporting requirements.
Representative Hillstrom.
Thank you, Madam Chair. So what do you collect about those procedures? Do you collect the doctor information and the patient code information, or what information do you collect about other telemedicine procedures?
Representative Whalen.
Thank you, Madam Chair. Thank you, Representative. I actually don't collect anything, but the department, I believe the Department of Health does, but they're here to answer questions. If you have further questions on that, I would refer to them.
Representative Hillstrom.
Thank you, Madam Chair. Oh, you're just pointing out this particular procedure for additional data collection. It would be helpful to know, how does this procedure compare to other data that's being collected on other telemedicine procedures? So if somebody can answer that question, that would certainly be helpful.
Does the Department of Health want to come forward? Somebody know the answer to that question?
Anybody know?
Mr. Pollack? Good morning. Welcome to the committee. Please state your name for the record and proceed answering the question if you know the answer.
Thank you, Madam Chair. Dan Pollack, Deputy Commissioner for the Department of Health. Representative Hillstrom's question, I believe, was what other forms of telemedicine procedure data do we collect? And the answer is none. We don't We don't collect data on telemedicine procedures. If there were problems about another telemedicine procedure, that might go to the Board of Medical Practice or the Board of Nursing.
Representative Hillstrom?
Thank you, Madam Chair. So Representative Whalen, in light of that testimony, why have you specifically targeted only this particular form of telemedicine and not others?
Representative Whalen?
Thank you, Madam Chair, and thank you, Representative Hillstrom. Forgive me for misspeaking. I just pulled out the statute on telemedicine services, and it says this is subdivision 3, Minnesota Statute 256B.0625. Telemedicine law states that as a condition of payment, licensed healthcare providers must document each occurrence of a health service provided by telemedicine to medical assistance enrollee. So there might be a little bit of clarity that I need to provide just for the record to say that the statute does address telemedicine in regards to licensed healthcare providers, that they must document the occurrence of a health service provided by telemedicine, including the location of the originating site and the distant site. And regarding this procedure in particular, currently we have agreed as the state of Minnesota in 1998, actually it was a DFL-controlled legislature, that information on abortion is important for policymaking purposes and other reasons. And right now there's an incomplete picture of the induced abortion services in the state because of this gap. 1998, telemedicine was not a service that was provided, and now it is. And this is simply updating the current laws to provide a more complete picture.
Representative Hillstrom?
Thank you, Madam Chair. Well, Representative Whalen, you're saying a more complete picture. Does that mean that if you pass this provision that you will have all of the information that you're looking for, or are you still looking for more that will not be in the statute?
Representative Whalen?
Thank you, Representative Scott, or Chair Scott, and Representative Hillstrom. I think it's important as policymakers to have as much information as we can when we're making decisions. And I think moving forward, I wouldn't want to say that this is all the data that I would ever think would be helpful or useful, but this absolutely will help us moving forward to have a more complete picture.
Representative Hillstrom?
Thank you, Madam Chair. Madam Chair, Representative Whalen, I know that this is one of the issues that you would like to see stopped in the state of Minnesota. I know that, and I understand that. And we see across the country that people are using these data collections procedures in order to stop behavior. And normally this committee wants to keep folks from collecting or accessing or using any kinds of data. So it strikes me as well, I won't go there. It strikes me that this is the one issue area where you just seem to not be able to get enough.
Representative Lesh?
Thank you, Madam Chair. Well, Madam Chair, is there anyone else scheduled to testify on this, or are we just asking the Representative Whalen on the firing line, and if anyone else can come down, they can? What's the story on that?
There's no one else signed up to
Okay.
testify.
All right, thanks, Madam Chair. Then I'll ask Representative Whalen. Representative Whalen, I heard you say that I think the testimony was that there was very little chance that any individual patients or providers could be identified using that data. Is that correct?
Representative Whalen?
Thank you, Madam Chair and Representative Lesh. That is correct. According to current statute, the commissioner is required to ensure that any data that could reasonably lead to the identification of an individual either receiving or performing an abortion not be made public.
Representative Lesh?
Thank you, Madam Chair. Historically, those kinds of assurances haven't necessarily satisfied the concerns of this committee, nor would I say has it satisfied your caucus when we talk about firearms background checks, for example. I'm wondering if, with respect to the security of the data, would you be satisfied if we said, say, firearms background checks, we can be assured that no one would see the identity of the holders of those licenses or permits? Would that satisfy you that data was secure if you were to vote on that?
Representative Whalen?
Thank you, Madam Chair. Representative Lesh, just to make sure I understand the question correctly, if a commissioner was required to suppress data on firearm background checks so that individuals couldn't be identified, would that satisfy me. Is that what you're asking?
Representative Lesh.
Madam Chair, Representative Whalen, yes.
Thank you, Madam Chair and Representative Lesh. I would actually want to know, I think historically, if the Commissioner of, would that be Public Safety, has been required to do that and how well they have done that, because the Commissioner, or at least the Department of Health in the state of Minnesota, has a fantastic track record on this specific issue. And to my knowledge, to date, there has never been a concern brought forward or an individual identified from this data. So I would think that maybe we should check with them to see how they do it and then go from there. But I would want to make sure that we have all the information we can.
Representative Lesh.
Okay, well, Madam Chair, thank you, Representative Whalen. That was a good dodge. I'm impressed. And I mean that genuinely, because it's a tough question to answer, right? There's no question that when we're talking about data, you can satisfy some people and you can. And usually whether or not you can satisfy them comes down to the politics of the subject matter of the data. And I think we all understand it's been danced around a little bit, but the reason you're bringing this bill here is because of abortion. And there's still a division in this legislature about whether or not people have the right to choose that or whether or not they should not in varying degrees. And I would just point out to you, this legislature has changed in attitudes about that over the years, too. You had stated that this was passed in 1998. I would point out that in 1998, that was the same year that this legislature passed the Defense of Marriage Act. Okay, gay people couldn't get married. And now it's legal in the state of Minnesota. Okay, so attitudes change a lot. I understand your passion over this issue, but there are those of us who do have legitimate concerns that because of the politics of this issue, folks could come after these people, whether they're providers or whether they're patients. That's a legitimate concern of mine. I understand your motivations, and I'm not going to argue with you about your motivations because I understand and I know where you're coming from. But I do think that the long-term security of the data should be of paramount importance just because of the way political attitudes change. So no other questions. Thank you, Madam Chair.
Thank you, Representative Lesh. And I've just been informed that we need to speak louder into our mics. There's some technical difficulties going on here this morning, so I'll talk louder. So Representative Carlson, if you want to speak loudly for the tape.
I'll do my best. Oh, I don't think we have any mics at all, do we?
Oh, I don't know. Yeah, we do.
Do we? Okay, a little bit.
Super low. Testing.
Can you hear
I'll
this?
talk loud. I'll talk loud. Thank you, Madam Chair. Representative Wayland, you're a strong supporter of data privacy rights. We heard that in your comments during Real ID. You spoke very eloquently in terms of protecting your constituents' privacy rights. I see a lot of potential for serious infringement on privacy rights within this bill that's being brought forward. Can you speak to how you can guarantee those protections of those privacy rights within this bill?
Representative Whalen.
Thank you, Madam Chair. Thank you, Representative. I will just refer everyone again to the statute that is current law. The Commissioner shall ensure that none of the information included in the public reports can reasonably lead to an individual having performed or having had an abortion. This would not change that, and I'm confident in the department to continue to uphold current law as they have done so well for the past several years.
Representative Carlson.
Thank you, Madam Chair. Representative Wayland. So thank you for pointing that out in the statute. Yes, we can all see it's there. My concern is, though, with this inherent risk for what I see as something that is doing nothing in which to protect women's rights, it seems like a great risk based on the reading of that and what we're after here. So I just don't think that this is worth that risk in terms of putting those potential privacy rights at risk. And I thought that would be something that would cause you concern as well. But thank you for pointing that out.
Well, Representative Carlson, on this reporting form, currently they have to list the facility code and the physician reporting codes. So regardless of the type of abortion that it was, you could still the same privacy risks are there now. You could argue, because they still have to put the facility reporting code where the abortion's being performed and the physician code where the physician is. So I don't see this as changing that. You could still pinpoint it to, the department still has the same obligation to protect people's privacy. Even if there's one person in the county, let's say there's only one person that's Asian in a county, that could be something that might identify them. That's where this piece of statute, where the department has to protect their identity, comes into play. Representative Carlson, I don't know if you have any. I'll give you a chance to respond since I brought it.
Thank you, yes, and I reviewed the form as well. I think that these infringements upon data privacy should call all of that into question, whether or not even that is necessary. So, I would be pushing back in the opposite direction and saying that we're putting people at great risk with their very sensitive data with these types of requests. So, I think it calls into question whether or not even receiving this kind of information is even necessary.
Well, I don't know the history of this report and how long it's been around, but I'm guessing it's been around a long time, and that the Department of Health finds some value in having this information. And I think this goes also to protecting women's health. If one of the reasons they collect this data is to make sure that abortion is safe, and so I think there's value in that. In that data. Representative Smith.
Madam Chair, thank you. Could we have the department come down and testify as to the length of time that this report has been in existence?
Certainly. Mr. Pollack is the closest one to the chair. I don't know if he wants to answer the question. Thank you for being here. And please introduce yourself for the tape and proceed with the testimony.
I'm Carol Hychek. I manage the collection of the data, and I produce the annual abortion report to the legislature.
Okay, and Representative Smith, did you want to re-ask the question?
Yeah, Madam Chair, thank you, testifier. How long has this report of induced abortion that was handed out, has this been in existence to your knowledge?
The data was first collected on that form starting in October of 1998. So the first published report covered those last few months of 1998 and all of 1999. So it has been an annual report since that time.
Thank you. Representative Smith?
Madam Chair, thank you. In addition, how many breaches of data security has there been reported to your knowledge since October of 1998?
To the testifier.
There have been none.
Thank you.
Representative Smith, thank you. Any other member questions? Representative O'Neill.
Thank you, Madam Chair. I thought in the testimony that we heard, not from the health department, but if I misunderstood, but I thought she said that 1/3 of abortions were from telemedicine. Was that no? Maybe you could testify as to how many you think are via telemedicine and how many abortions we're missing in this report right now, or maybe Representative Whalen knows that answer.
Representative Whalen?
Thank you, Madam Chair, and thank you, Representative O'Neill. I believe it was medicinal abortions, which are what a telemedicine abortion would be. So it's not that 1/3 of abortions in the state of Minnesota are telemedicine, but that they are performed with with drugs, and those drugs can be used in a telemedicine abortion, if that answers the question.
Representative O'Neill?
Thank you, Madam Chair. So there's a potential that we could be missing 1/3 of all the abortions if we don't change this. That's the potential is there. Or right now, we're definitely missing a whole lot. But
thank you, Madam Chair, and thank you, Representative O'Neill. I don't believe so, but I can defer to the department on that. I will say I believe that right now the method of abortion is reported. So in the report, there's a table that shows the methods, including I think it's non-surgical or medicinal. And within that, that's where you would have telemedicine abortions show up. So all of those, I would hope, are being reported. And then we would just want to know which ones are being done via webcam or telemedicine.
okay, thank you.
To the testifier from the department, do you happen to know the answer to that? Otherwise, we can bring up a previous testifier.
To the best of our knowledge, all abortions that are performed in Minnesota are reported to us. The piece of information that you're referring to that's missing, we do not collect information on whether the physician and the patient are at the same location.
Thank you. Thank you. Representative O'Neill, any follow-ups? Okay, thank you. I had a question for the Andrea Ledger. Thank you for being here. Ms. Ledger, did you testify that in Iowa they have a count on how many abortions are performed by telemedicine?
No, Madam Chair, to clear up the confusion, the count that I reported was that 1/3 of abortions in Minnesota are performed via medication abortion, non-surgical, as the department just testified. And that method is the method that would be used in telemedicine. The only issue would be where the doctor and the patient are located. And that's where the telemedicine angle comes in. The information about Iowa was from an Iowa study, and let me look back at my notes. Excuse me. An Iowa study of patients found that 600 women there who utilized abortion via telemedicine had comparable clinical outcomes to those who saw the doctor in person.
So there was information collected in the state of Iowa that 600 abortions were done via telemedicine. That's what you just stated. Is that correct?
In the state of Iowa, it was a study. It was a clinical study. So I imagine that, like with any other clinical study, that patients opted into that study for the data collection piece.
Okay. Well, I think, it's Iowa saw it as a valuable piece of information to have. I don't see why Minnesota should be any different. Thank you for your testimony. Are there any other member questions? Representative Hillstrom.
Thank you, Madam Chair. I don't know if Ms. Ledger knows the answer to this question, but did they identify the doctor and the patient code in the information that they collected, or was there any reason why the state would have had that information in the study? Because, members, that's what we're talking about here. Should government collect the doctor code and the location code and disclose to the public information about your constituents? And as folks on this committee who don't like it when government collects data about their citizens, I find this interesting. So does the government in Iowa collect this data about the people who are performing?
Ms. Ledger.
Madam Chair, Representative Hillstrom, I am not familiar with what the Iowa state statute requires in terms of reporting. I can say that for the information collected in this study, it was a clinical study that patients opted into. So they chose to disclose that information to the researchers who were performing the study.
Thank you. Representative Hillstrom, do you consider abortion women's health?
Madam Chair, I believe that things that happen between doctors and patients are between the doctor and the patient. And Madam Chair, I have known you for a long time to not want to disclose what happens between doctors and patients, except in this case. And so, Madam Chair, I believe that we need to protect women's access to all forms of health care. We are not here regulating or saying anytime a male has a vasectomy or anytime a male gets Viagra that they should be placed in a database. And that's what you're saying here, Madam Chair. When a woman receives a particular type of health care, she should be placed in a state database. When a doctor performs a particular type of health care, he should be placed in a state database. That's what you're doing.
So then you'd be okay if we just didn't have this form? And none of these records were kept?
Madam Chair, I have long since supported people's right to their data privacy in their health care. And it's interesting that we're having this conversation even because I actually want to access prescription monitoring, which we already collect. And Madam Chair, you wouldn't even give Representative Baker's bill a hearing. And so we're going to be offering that as amendment on the floor today. So it's okay to collect all of this data and disclose it to the public with related to this particular kind of procedure, but it's not okay when it comes to even prescription pills for opioid addiction.
And I would argue that the Department of Health keeps a lot of data that many of us disagree with. You're absolutely right. And so the newborn screening is one of those. And so I'm sure that if we re-offered a bill on that everyone would agree that they shouldn't be collecting that data.
But they should collect this.
Well, I'm just saying there's inconsistencies throughout law, and it's an important issue. Representative Whalen, I'll give you the last word.
Thank you, Madam Chair, and thank you, members and testifiers, for your engagement on this topic. I just want to clarify one more time that current statute does require that any data that could reasonably lead to the identification of an individual performing or receiving an abortion not be made public, as there have been a few insinuations that this could be leaked and made public, and that is not at all what this bill does, nor what it is seeking to do. Furthermore, based on some of the comments that were made regarding why we do different reporting requirements for this specific procedure versus other procedures, as has also been either stated or at least alluded to, there is a difference regarding the abortion procedure in the minds of many. Not necessarily everyone in this room, but in the minds of many, including myself and my constituents, that it's not like a vasectomy where it's a man and one individual. It's a woman and another individual, which could be a man or a woman, a baby. And so this is different, and it is important that we collect this information so that we as policymakers have all of the information we can to make the best decisions possible. Thank you for hearing the bill today, Madam Chair and members.
Thank you, Representative Whalen.